Hello, so I would like to talk a little bit now about amenorrhea. This is something that I have seen quite a few times in the clinic. Sometimes actually people may have come to me for other reasons, like they have had migraines or something like that, and then I will ask, are they menstrually related? And that person will sometimes say, actually, I've never had a period, and they don't ever seem to think that that is something to be concerned about. So obviously in Chinese medicine, this is quite a big thing to be happening. If you've never menstruated, it's called primary amenorrhea, and it's harder to treat. If you have been menstruating and your periods have stopped, then that is easier to treat. It does take some time with acupuncture to restore your cycle. It can take up to 3 months. So we work a lot very closely with you in terms of diet. You really need to be eating a lot of blood nourishing foods. The cycle of the moon, because you don't have a natural cycle, so we will actually be working with the full moon, so trying to promote ovulation around the time of the full moon. And using that as a basis for your cycle. And as I say, there can be lots of people who have amenorrhea and who have never really seen it as much of an issue. So there are different reasons why it can happen. Some of them can be quite complex. Some of them are quite straightforward or easy to pinpoint. So for some people, maybe they are drastically underweight. Maybe some people have a history of anorexia, or maybe they are extremely athletic. So athletes, quite often their periods will stop as they lose fat on their body and become very kind of lean muscle that will actually trigger amenorrhea. So for those types of people whose periods have recently stopped, we can get them to restart again. If it's primary amenorrhea, it's harder to treat. So in terms of Western medical support, I think that if your primary concern is really to conceive, then that you will be offered drugs which you might want to consider. So there's Clomid, which is very well known, which is something that can be used to kind of stimulate ovulation, and then obviously you would be going into an IVF cycle. So that's just a kind of brief outline about the differences between Western medicine and Chinese medicine. We have quite different viewpoints on it. So Western medicine will just try and circumnavigate it, whereas Chinese medicine will actually try and restart your cycles, which I think in the long run is probably better. But if you are looking for a short-term solution, then you might consider the Western option. But, you can definitely get support through that with acupuncture. Even if you are taking an ovarian stimulating drug and going through IVF, it's still worth coming for acupuncture. It's still worth taking the blood nourishing foods. It's still worth getting treatment for why this has happened in the first place, and to treat that pattern and that disorder. It can only help if you're also thinking about IVF.